Okay, let's unpack this. Paramedics, you see the flashing lights, hear the sirens, and instantly think emergency.
Yeah, that's the immediate image.
But what if I told you that the real depth of their work lies in this incredible foundation of knowledge, a universe of skills that goes way beyond those critical moments of action?
What's truly eye-opening is just how much they need to know. It's not just about reacting when something goes wrong. It's a profound understanding of keeping themselves safe, connecting with people in crisis, the intricate workings of the human body,
Right.
and navigating a surprisingly complex set of rules and ethical considerations.
Exactly. And for this deep dive, we've pulled together a fascinating collection of information. Quick guides to medical situations, breakdowns of how our bodies function, details on medications, legal guidelines, you name it.
Hmm.
Our mission today is to extract the absolute core principles, those genuinely surprising insights, and give you, the listener, a clear and concise understanding of what makes this vital profession tick without getting lost in, a mountain of jargon.
And if we step back and look at the bigger picture, understanding the fundamental knowledge a paramedic relies on gives you a window into so many related areas, from general medicine to how we respond in emergencies, and even the psychology of people facing extreme pressure.
So with all this information, where do we even begin? Well, what comes through loud and clear from our sources is that everything starts with one crucial element:
Hmm.
safety.
That's absolutely the bedrock.
Yeah.
The most important thing is that the paramedic themselves is safe. If they're not, they can't effectively help anyone else. Simple as that.
And it's not just about avoiding the obvious dangers at an emergency scene, like traffic or whatever.
Hmm.
We're talking about the routine but critical use of personal protective equipment, PPE.
Definitely.
Our materials emphasize that at a minimum, wearing protective gloves for every single patient interaction is non-negotiable. But it definitely doesn't stop there, does it?
No, not at all. Depending on what they're facing, paramedics might need to use face masks, and in more extreme situations, maybe even full-body hazmat suits with their own air supply. Think about it. They respond to such a huge variety of places, from someone's home, bedside, to, as our sources point out, really challenging environments like mountains or industrial facilities.
Totally different hazards.
Their safety gear has to match that reality.
And it's not only about things like chemicals or infections. One of the surprising things that really stood out is the significant risk of physical injury, especially back
Oh,
injuries.
huge, yeah.
It's a sobering thought that something like lifting a patient incorrectly could actually end a paramedic's career.
This raises a really important point. How do paramedics protect themselves from these physical demands? Our sources provide some very specific and practical techniques.
Right. It's all about being smart and following a careful procedure. Asking for help with lifting is crucial. Always bending at your knees, think squat, not just leaning over.
Right, using your legs.
Keeping your feet spread apart for a stable base. And this is key: never twisting your body while you're lifting.
That twisting motion is so dangerous for the back.
They also stress the importance of making sure the weight is balanced, so one person isn't carrying more than their share.
Mm-hmm.
For really tough situations, like moving someone up or down a steep slope, having multiple rescuers is essential, and specialized equipment like powered stretchers can make a huge difference.
What's interesting is that the level of detail in these seemingly simple instructions, it really highlights just how physically demanding this job is, day in and day out.
And there's another kind of injury that our sources bring up, something that's not always visible but can be just as damaging: stress.
Ah, yes, the hidden toll.
It's described as a silent career ender sometimes.
This is a critical insight. The constant exposure to really stressful situations, to trauma, and to human suffering takes a very real toll on their well-being. Our sources list some potential effects like trouble sleeping, changes in appetite,
Yeah.
a consistently raised heart rate and blood pressure, and increased irritability, just feeling on edge all the time.
So it's not just about being physically tough. There is a huge mental and emotional aspect to staying safe and being able to do this job effectively.
Absolutely.
The advice is clear. If you're feeling overwhelmed by stress, it's vital to recognize those signs and seek help from professionals who specialize in stress counseling.
Don't tough it out alone.
Exactly. It really emphasizes how important it is to look after the whole person.
And if we connect this back to your interest in really understanding this topic, grasping these safety principles, both for their physical and mental health, is the absolute foundation on which everything else a paramedic does is built. You can't skip this part.
Absolutely. Now, let's shift our focus a little. Paramedics aren't just dealing with the immediate medical crisis. They're often stepping into incredibly sensitive and difficult human situations, particularly when they involve, well, death and dying.
This is a profoundly human part of the job. It's incredibly difficult. Our sources offer guidance on how paramedics should communicate with families during these incredibly painful moments.
And it's advice that's both direct and compassionate. Using clear and unambiguous language, for example, saying something like, "I am very sorry for your loss. We did everything we could, but we were unable to save him," is really emphasized.
No beating around the bush.
Right. There's no place for softer language or avoiding the truth in those critical moments.
The importance of being truthful is also highlighted. Families are already experiencing immense grief, and honesty, delivered with empathy and respect, is absolutely crucial.
And the paramedic's role doesn't end with simply stating what has happened. The sources stress the need to stay with the family and offer whatever assistance they can.
Just being present.
Exactly. It's acknowledged that people will react in very different ways, from quiet, thanks to even anger, and these are presented as normal responses in the face of such loss. It's part of the grief process.
This really broadens our understanding of what a paramedic does. It's not just about the medical procedures, it's also about providing essential emotional support during times of intense personal crisis.
It's about seeing the person behind the patient and the family surrounding them, even in the midst of the emergency, isn't it?
Yeah, absolutely. That human connection.
Okay, let's move from these incredibly sensitive situations to the core medical knowledge that paramedics rely on their essential toolkit of understanding the human body.
Right, the science bit. This involves a deep understanding of human anatomy, how our bodies are structured, and physiology, how they function. Our sources start with the fundamental building blocks, cells,
The very basic.
which then group together to form tissues. We have epithelial tissue that covers surfaces, nervous tissue for communication throughout the body, and then the different types of muscle tissue, cardiac muscle in the heart, smooth muscle in our organs, and skeletal muscle that allows us to move, and connective tissue too, holding things together.
Right, like bone, cartilage, blood.
Exactly.
Yeah.
Lymphatic tissue, loose, dense. It's all connective.
And then these different tissues work together to form organs. Organs then cooperate within systems, and all those systems combine to create the entire organism. The sources give us a really concise overview of the major body systems and what their main jobs are.
Yeah, it's a good refresher. We have the circulatory system responsible for moving blood around, the digestive system that processes our food, the endocrine system that uses hormones to regulate cell activity.
Like metabolism and stuff.
Yeah, and growth. Then the integumentary system, that's our skin, providing a protective barrier. The muscular system enables movement, and the nervous system controls everything from our conscious actions to our automatic bodily functions.
And we shouldn't forget the reproductive systems, both male and female. The respiratory system for taking in oxygen and releasing carbon dioxide,
Crucial.
and the skeletal system. I was actually surprised by how many roles the skeletal system plays. It's not just about support with its 206 bones, ligaments, and cartilage, and allowing movement via tendons.
Protection too.
Yeah, like the ribs protecting the heart and lungs.
Yeah.
But also storing important minerals like calcium and lipids, producing blood cells in the bone marrow.
Right, in the marrow.
And even helps regulate blood sugar and fat storage through something called osteocalcin. Who knew?
It's pretty complex. And lastly, the urinary system, which is absolutely critical for getting rid of waste products, regulating our blood volume and pressure, keeping our electrolytes balanced.
And maintaining the delicate acid-base balance in our bodies.
Ah, yes, that one.
Acid-base balance. This seemed like a really fundamental concept that the sources went into. It's all about the concentration of hydrogen ions in our body fluids, right?
That's the core of it, yeah.
And it's measured on that pH scale we all learned about in science class.
Precisely. The pH scale runs from 0 to 14, with 7 being neutral. In a healthy human body, the pH is very tightly controlled, usually staying between 7.35 and 7.45. It's a narrow window.
Very narrow.
Our sources outline various conditions that can cause the body to become too acidic, with a pH below 7.35, that's acidosis, or too alkaline, with a pH above 7.45, alkalosis.
The things like problems with your lungs or kidneys, certain medications, even just being dehydrated can push you towards being too acidic, acidosis.
Right, or severe infections, diabetes complications, lots of things.
On the other hand, other medications, or even being at a very high altitude or maybe vomiting excessively, can make you more alkaline.
Correct. But how does the body actually keep this balance? It sounds incredibly delicate.
It does.
The body has three main systems that work to regulate this. The bicarbonate buffer system is the quickest, sort of the first line of defense,
Okay.
and it's all driven by the levels of carbon dioxide in our blood. The chemical equation shows how carbon dioxide and water can combine to form carbonic acid, which can then break down into hydrogen and bicarbonate ions.
Uh-huh.
The system can shift in either direction depending on the concentrations of these substances. Think of it like a chemical seesaw trying to stay level.
Okay, so if carbon dioxide builds up, making things more acidic, the body tries to shift that balance back by changing those chemicals around. It uses up the acid or creates more base.
Exactly. Then we have the respiratory system, or breathing. If carbon dioxide levels in the blood rise, making it more acidic,
You breathe faster.
you got it. The body responds by making us breathe faster and deeper to expel that extra CO2. Conversely, if CO2 levels drop too low, making it alkaline, our breathing slows down to hold on to more of it.
That makes perfect sense. A really fast way to make adjustments. And then the third system is the renal system, our kidneys.
Right. The kidneys provide a slower but more long-term way to regulate pH. They're the heavy lifters for long-term balance.
How do they do it?
If the body is too alkaline, they'll excrete more bicarbonate in the urine. If it's too acidic, they'll hold on to bicarbonate and excrete more hydrogen ions.
Do they fine-tune it over hours or days?
Exactly. The sources also point out that these imbalances can have different origins, either metabolic problems with body chemistry or respiratory problems with breathing.
Right.
And there's a really useful clinical observation, a sort of pearl of wisdom. If the amount of carbon dioxide in the arteries, what's called PaSO2, is high, you'll typically see the person breathing rapidly, trying to blow it off.
It's just amazing to see how all these different parts of our body are constantly communicating and working together to keep us within that really narrow, healthy pH range.
It really is.
It definitely gives you one of those aha moments, realizing the body's incredible ability to keep itself in balance.
Absolutely. Now, building on this fundamental understanding, paramedics are on the front lines dealing with a really wide range of common medical emergencies. Our sources provide concise but crucial overviews of many of these situations.
Yeah, it's quite a list. We're talking about everything from adrenal insufficiency, where the adrenal glands don't produce enough essential hormones, leading to things like low blood pressure and muscle weakness.
Generally treated with hormone replacement.
Right. Then there are potentially life-threatening allergic reactions, where the body's immune system goes into overdrive.
Anaphylaxis being the most severe form.
Yeah, causing symptoms like low blood pressure, hives, facial swelling, often requiring treatments like albuterol to open the airways, steroids to calm the immune response, and medications called pressors to raise blood pressure.
Epinephrine is key in anaphylaxis too. Next is hypoglycemia, which is low blood sugar. This can cause someone to become confused or even lose consciousness, like altered mental status.
Very common with diabetes or insulin overdose.
Exactly. And it needs to be treated quickly with glucose, either given by mouth or intravenously, or with a hormone called glucagon.
Then bronchospasm, a narrowing of the airways in the lungs, often triggered by asthma or allergies.
Makes it hard to breathe out.
Treated with oxygen and medications that help open the airways, like albuterol, maybe epitropium, sometimes epinephrine, steroids, even magnesium sulfate in severe cases.
Lots of options there. And then we have the dangers of extreme temperatures. Hyperthermia, when the body gets too hot.
Which can progress from muscle cramps to heat exhaustion and then the very dangerous heat stroke.
Right. Heat stroke is a true emergency. Body can't regulate temperature anymore. Each stage needs different cooling methods. And the opposite, hypothermia, when the body gets too cold, which requires careful rewarming. You have to be careful not to rewarm too quickly externally.
Right, that can cause problems with the core temperature. Okay, what else?
The sources also detail the very serious risks of nerve agent and organophosphate poisoning.
Oh yeah, the SLUDGEM acronym.
That's the one: salivation, lacrimation, urination, defecation, gastric upset, emesis, meiosis, or pinpoint pupils. And the killer bees: bradycardia, slow heart rate, bronchorrhea, excess mucus, bronchospasm.
Scary stuff. Critical need for paramedics to protect themselves with hazmat gear and use specific treatments like oxygen, atropine, and pralidoxim.
And benzodiazepines for seizures sometimes. Scene safety is paramount there. And then we move into the unique challenges of OB emergencies.
Right, related to pregnancy and childbirth. Things like eclamptic seizures, which involve high blood pressure during pregnancy.
And protein in the urine, swelling. It can happen postpartum too.
Then situations like a prolapsed umbilical cord, where the cord comes out before the baby.
Requires specific positioning, trying to lift the baby off the cord, and rapid transport.
Or A neutral cord wrapped around the baby's neck, vaginal bleeding during pregnancy from issues like placenta previa or abruption.
Ectopic pregnancies, too, where the baby develops outside the uterus, super dangerous if it ruptures.
Yeah, causing severe pain, possibly shock. And of course, the absolutely vital steps of newborn resuscitation if the baby isn't breathing well at birth. Drying, warming, clearing the airway.
Checking circulation, APGAR scores, it's a whole separate protocol.
It's really a long list, and it highlights just how many different medical challenges a paramedic might encounter during any given shift.
It really does. The information also covers pain management, listing common medications they are authorized to give, like acetaminophen, ibuprofen, ketorolac for moderate pain, and then stronger options like fentanyl, morphine, ketamine, even nitrous oxide sometimes.
Opioid overdose, with its key signs like slowed breathing, unresponsiveness, and those pinpoint pupils.
The classic triad.
And the life-saving medication naloxone or Narcan. Plus oxygen support. Have to consider if other drugs were taken too.
Always. And seizures, with their various types, from simple partial affecting just one area of the brain to complex, partial, and generalized seizures like tonic-clonic.
The grand mal seizures.
Right. The treatment protocols emphasize protecting the person from injury and using medications like benzodiazepines, often given IV or IM for severe or prolonged seizures.
We also get an overview of syncope, which is fainting, and the many potential underlying causes.
Could be something simple like standing too long, or something serious like a heart problem.
Highlighting the need for a thorough assessment vitals, ECG, blood sugar, to figure out why it happened.
Definitely. And then there's shock, that really critical condition where the body isn't getting enough blood flow to the tissues, poor perfusion, it's life-threatening.
And there are different types, right? Cardiogenic from the heart failing, distributive like in severe allergies or sepsis.
Hypovolemic from blood loss. Obstructive, like a pulmonary embolism.
General symptoms include low blood pressure and altered mental state, maybe cardiac issues, low urine output, rapid heart rate, but specifics vary.
And treatment involves figuring out the type, giving oxygen carefully, maybe fluids.
But carefully, right? You mentioned permissive hypotension earlier.
Exactly, especially in trauma, just trying to restore perfusion, not necessarily a normal blood pressure. Too much fluid can be bad. Need pressure sometimes, and obviously stop the source of the problem if possible, like bleeding. Maybe clotting agents like TXA.
Got it. What about sepsis?
Sepsis is a severe body-wide response to infection, often bacterial, that can lead to septic shock, which is a type of distributive shock.
How does it present?
Usually a history of infection, maybe abnormal temperature, low end-tidal CO2, high lactate levels, low blood pressure, confusion, rapid heart rate. Similar to shock, but with an infection source. Treatments involve fluids, pressors.
Okay. And stroke?
Stroke, or CVA, cerebrovascular accident, can be ischemic, caused by a clot blocking blood flow in the brain.
Or hemorrhagic bleeding in the brain.
Right. Symptoms are often unilateral weakness or loss of function on one side of the face, arm or leg, trouble speaking or understanding, vision problems, dizziness, severe headache.
Time is critical with stroke, right? Noting the onset time.
Absolutely critical. Treatments include getting IV access, checking blood sugar because low sugar can mimic stroke, maybe holding off on oxygen unless levels are low, and getting them to a specialized stroke center fast.
Makes sense. Then there's abdominal pain, which could be almost anything.
Exactly. The differential diagnosis is huge. The goals are patient comfort and identifying anything immediately life-threatening, like a perforated bowel, an aneurysm, appendicitis, gallbladder issues.
So IV access, pain management.
Yep. Support care while trying to figure it out. And finally, a really big one, cardiac emergencies.
Yeah, heart stuff. Acute coronary syndrome, ACS.
Right. That's the umbrella term for conditions like angina, unstable angina, heart attack. Symptoms can be classic chest pain, but also weakness, shortness of breath, pain radiating to the arm or jaw, sweating, anxiety.
Treatments involve getting a 12-lead ECG quickly, oxygen if needed, but cautiously, aspirin, nitroglycerin, maybe pain meds, fluids, or pressors if blood pressure is low, and transport to a hospital capable of procedures like PCI if it's a STEMI heart attack.
Then you have fast heart rhythms like supraventricular tachycardia, SVT, usually narrow QRS complex.
Treated with things like vagal maneuvers or medications like adenosine, diltiazem, amiodarone if stable, or cardioversion if unstable.
And ventricular tachycardia, VTach, usually wide QRS. Similar approach. Meds like amiodarone or lidocaine if stable, cardioversion if unstable.
What about AFib or aflutter?
Atrial fibrillation or flutter can be irregular or have regular flutter waves, often with a rapid ventricular response. Symptoms are similar, maybe palpitations too. Again, meds like diltiazem, metoprolol, amiodarone if stable, cardioversion if unstable, always with appropriate sedation for cardioversion.
And slow heart rates. Bradycardia.
Bradycardia, heart rate under 60, but you really treat if it's symptomatic, causing weakness, chest pain, shortness of breath. Treatments depend on severity, could be pacing with external pads, medications like atropine, or infusions of epinephrine or dopamine.
Okay. And the ultimate cardiac emergency. Cardiac arrest.
Yeah, CPR is the foundation with good ventilations and oxygen. Then analyzing the rhythm, if it's a systole or PEA, epinephrine primarily. If it's VFib or pulseless VTach, defibrillation is key.
Plus other meds like sodium bicarb, amiodarone, lidocaine.
And remembering the reversible causes, the H's and T's, like hypoxia, hypovolemia, hydrogen ion acidosis, hyperhypokalemia, hypothermia, and toxins, tamponade, tension pneumothorax, thrombosis, coronary or pulmonary.
Always look for the why. What about congestive heart failure, CHF?
CHF or pulmonary edema. Often the left side of the heart can't keep up, pressure backs up into the lungs, fluid leaks out. Similar to ACS, but often with wet lung sounds, maybe high blood pressure, cough with frothy sputum, swelling in the legs. Treatments include nitroglycerin, diuretics like furosemide, maybe pressors if BP is low, sitting the patient upright, oxygen, and often CPAP to help push fluid out of the air sacs.
And you mentioned the 12-lead ECG.
Yeah.
That's key for identifying stimulus, right? Specific types of heart attacks.
Exactly. It involves placing electrodes on the limbs and chest in specific spots, V1 through V6. You look for ST segment elevation of a certain amount in 2 or more leads that look at the same area of the heart septal, anterior, lateral, inferior walls. You also look for reciprocal changes in opposite leads.
It's a tremendous amount of information, but it really shows the depth of medical knowledge that paramedics have to have ready to go
Instantly available, yeah.
in order to even begin to assess and treat patients in these really critical situations. It definitely reinforces that idea of needing to gain knowledge quickly but thoroughly. They need to know a little bit about a lot of things and know well enough to make fast, informed decisions.
Precisely. And beyond these sudden illnesses, paramedics are also frequently called to scenes of trauma, injuries. Our sources outline general guidelines for managing trauma patients, emphasizing that the very first thing they do is assess and treat any immediate life-threatening injuries.
Like major bleeding.
Profound bleeding, yeah. Direct pressure, maybe tourniquets noting the time or hemostatic agents, then airway and breathing problems, and a quick neurological check.
The importance of getting the patient out of the dangerous situation quickly but safely is stressed.
Extrication, yeah. Might need special training for that.
Along with doing a more detailed examination head to toe, front and back, once the immediate threats are taken care of, ideally in a warm environment.
Getting the patient to a specialized trauma center is often vital. Paramedics need to be aware of things like whether the patient might be under the influence of alcohol or drugs,
Which can affect their assessment and response.
or if they take any medications that could affect how they respond to their injuries, like blood thinners or beta blockers. And again, that concept of permissive hypotension comes up carefully managing blood pressure and trauma, targeting perfusion, not just a number, warns against pushing too much fluid, which can worsen bleeding or cause other complications.
Got it. The sources also detail what are called the trauma killers, those critical conditions beyond just breathing and bleeding that can quickly lead to death.
After the ABCs, yeah. Things like traumatic brain injury, massive hemorrhage, tension pneumothorax, where air gets trapped in the chest and collapses a lung.
Cardiac tamponade, where fluid builds up around the heart, or even an air embolism.
Things you have to find and fix fast. Then we move into specific types of injuries, starting with burns. They're categorized by how deep they go superficial, like a sunburn, partial thickness with blisters, full thickness involving deeper tissue.
And how severe they are depends on depth, location, hands, feet, face, genitals, or worse, and how much of the body is burned.
Right. Different approaches for treating chemical burns versus thermal burns. With chemical, safety first, identify the agent, brush off dry chemicals, flush with water if appropriate, but some react with water.
Good point. Thermal burns stop the burning, cool it appropriately, remove clothing unless stuck, cover with clean, dry dressings, keep the patient warm.
And the rule of nines, a way to estimate how much of the body surface is burnt.
Helps calculate fluid needs, right, using the Parkland formula.
Exactly. The Parkland formula helps estimate how much intravenous fluids a burn patient needs, typically 2 to 4 milliliters per kilogram of body weight per percentage of total body surface burned, or TBSB. Half given in the first 8 hours, the rest over the next 16, though you might adjust for heart failure patients. Also have to think about potential cyanide poisoning with inhalation injuries.
And be ready for airway swelling with inhalation burns might need intubation early.
Definitely. Airway edema can progress really rapidly. RSI might be needed.
Okay. We also get brief overviews of other types of trauma, blast injuries.
Yeah, complex. Safety first again. Can cause multi-system trauma, chemical exposure, burns, barotrauma from the pressure wave, blunt or penetrating injuries from debris.
Crush injuries.
Yeah.
Risk of hyperkalemia, hypotassium.
Yes, from muscle breakdown. Can see changes on the ECG like tall peaked T waves or wide QRS. Might need calcium, albuterol, sodium bicarb to manage it.
Facial trauma priority is keeping the airway open and trying to save vision and teeth. Can bleed a lot. Collect lost teeth carefully.
Eye trauma, shield both eyes. Don't try to put a dislodged eyeball back in.
Jaw trauma, big airway risk. Need suction ready, nosebleeds, or epistaxis.
Squeeze the nostrils for 10-15 minutes.
What if parts of the nose, ear, or lip are torn off? Avulsions.
We'll cover the tissue if possible, wrap in sterile gauze, put in a plastic bag, keep it cool on ice, but not direct contact.
Head trauma, emphasize stabilizing the neck. Repeat neuro exams. Crucial not to overventilate or over-oxygenate. Target normal CO2 levels. Intubation might be needed.
Spinal trauma, immobilize the spine when appropriate, but minimize complications from the devices themselves. How to safely remove helmets while maintaining stabilization.
Injuries to the chest and abdomen, always suspect spinal injury too. Secure impaled objects, don't remove them. Open pneumothorax or sucking chest wound.
Needs an occlusive dressing, vented on 3 sides usually. Monitor closely for tension pneumothorax.
Which presents how?
Worsening difficulty breathing, decreased breath sounds on that side, maybe jugular vein distension, narrow pulse pressure, eventually tracheal deviation, that's a late sign. May need needle decompression.
Flail chest, where a segment of ribs is broken in multiple places.
Paradoxical movement, yeah. Position them, maybe stabilize manually, consider positive pressure ventilation.
And submersion injuries, like near drowning, early resuscitation is key. Consider spinal injuries, definitely watch for hypothermia.
Lots of specific trauma considerations. And finally, within the area of trauma, the absolutely crucial skill of airway management is addressed.
Always back to the airway.
Always. The ultimate goal, as our sources state, is to ensure a clear, patent airway and good levels of oxygen saturation, SpO2, and end tidal carbon dioxide at CO2. Capnography, measuring that exhaled CO2, is emphasized as a vital tool standard of care.
Why is it so important?
It verifies that a breathing tube is in the trachea, not the esophagus. It provides a real-time waveform that can indicate problems like bronchospasm or a leaky tube cuff. It helps assess if treatments for breathing problems are working, helps guide ventilation rates, can even indicate return of circulation during CPR. It's not just a number, the waveform tells a story. Use it with pulse oximetry.
Okay. Need to confirm good breath sounds too, right? No stomach sounds.
Absolutely. Clear bilateral breath sounds, no epigastric sounds, misting in the tube, and active ETCCO2 and pulse ox readings confirm placement for any advanced airway.
What are the different ways to manage the airway?
Starts non-invasive. Nasal cannula, simple mask, non-rebreather mask, CPAP for conscious patients, bag valve mask, BVM ventilation. Then invasive methods.
Like endotracheal intubation, putting a tube in the windpipe?
Right, ET tubes. Considered the gold standard by many because it isolates the airway, helps prevent aspiration, allows controlled ventilation and suctioning, but it requires significant training and equipment, and there's a risk of putting it in the esophagus.
What else?
Supraglottic airways like LMAs or King airways. Quicker to insert, less risk of trauma perhaps, good backup if intubation fails, but maybe less protection against aspiration. And then cricothyrotomy.
Cutting the neck.
Essentially, yes. Needle or surgical cricothyrotomy. Requires special training. It's a last resort when you can't intubate or ventilate. Involves piercing the cricothyroid membrane.
And rapid sequence intubation, RSI.
That's using pharmacology medications to facilitate intubation. An induction agent to sedate the patient, like etomidate or ketamine, and a paralytic agent to relax the muscles, like ursinylcholine or rocuronium. Needs a high level of training, careful airway assessment beforehand, like checking hired mental distance. You have to be sure you can manage the airway before you paralyze someone.
Wow, complex. And after the tube is in.
Post-intubation management is crucial. Continuous monitoring of ETCO2, SpO2, breath sounds, secure the airway device properly, reconfirm placement frequently, suction if needed. Be ready to provide sedation if the patient starts to wake up.
It's a really comprehensive look at the physical challenges of trauma and the immediate medical interventions that paramedics are trained to perform. Now, moving beyond the immediate medical and traumatic emergencies, there's a whole framework of legal, ethical, and professional considerations that guide how paramedics do their jobs.
This is where the broader context of the profession really comes into focus. It's not just medicine, it's practice within society. Our sources discuss how paramedics are governed by regulations at the local, state, and federal levels.
So specific protocols they have to follow in their area.
Exactly. Requirements for their licenses and certifications, laws related to healthcare like Medicare and Medicaid billing, and the Health Insurance Portability and Accountability Act, or IPA, protecting patient privacy.
We also learned about the roles of the different agencies that oversee paramedics, making sure they're following medication guidelines, especially for controlled substances, and adhering to established protocols reviewed by state or regional councils.
Right. And the difference between being licensed and certified is explained. Certification often recognizes competence, while licensure grants the legal authority to practice. They're often intertwined,
Good Samaritan laws are discussed.
which offers some legal protection to people who provide reasonable help in an emergency off-duty. But these laws generally don't protect against gross negligence or reckless behavior, and usually don't cover on-duty professionals who have a duty to act anyway. Always need to check local laws.
Patient restraint is a sensitive issue.
Definitely. The guidelines emphasize that it should only be used when a patient is a danger to themselves or others, and less restrictive means haven't worked or aren't appropriate. Can use physical methods like soft restraints on extremities, checking circulation frequently, or chemical methods with injectable medications. Cautious use, detailed documentation required, and must follow state and local guidelines as laws vary widely.
The rights of patients during transport are covered, stressing that everyone has the right to safe and secure transportation in an ambulance.
Fully secured to the cot secure in the ambulance, no loose objects flying around.
Right, and that right exists regardless of the paramedic's initial assessment of how serious things are. Patients with medical conditions generally shouldn't walk if there's a chance they could worsen. Sometimes protocols allow diverting to a more serious call, but the initial patient still needs transport arranged. Destination is based on patient choice, if appropriate, local protocols for specialty centers like trauma or stroke centers, the patient's condition, and distance.
And the flip side, the right to refuse medical treatment and transport.
Yeah, that's a big one. The patient must have the capacity to understand their condition, the risks of refusing, and the benefits of treatment. They need to be legally competent, generally adults, or emancipated minors.
And the paramedic has to make sure they're fully informed, explaining the facts and potential consequences clearly.
Right. Well-documented refusals are absolutely crucial for legal protection. Need to follow local protocols strictly. Parents or guardians can refuse for a minor if they meet the criteria.
The complex legal and ethical considerations surrounding when to start and when to stop resuscitation efforts are acknowledged.
Like CPR.
Exactly. State laws and specific protocols often guide this, including honoring documents like healthcare proxies or multipost forms, medical physician orders for life-sustaining treatment. There are usually specific criteria for ceasing resuscitation efforts in the field if they're unsuccessful. Again, highly state and regionally specific. Documentation is key.
The importance of using proper medical terminology and thorough documentation is highlighted.
Makes you sound professional, earns respect, improves communication, and creates a solid legal record.
Most terms come from Latin or Greek. Abbreviations can be helpful but need to be used carefully so they're clear.
And all documentation is essentially a narrative of what happened. The assessment, the treatments, how things changed, need pertinent positives and negatives. It's a permanent part of the medical record, could be used in court years later. Clear documentation is vital.
Mentions common documentation formats like SOAP, subjective, objective assessment plan.
Or chart chief complaint, history, assessment, RX treatment, transport. Different systems use different formats.
The vital role of continuing research in improving the field of paramedicine is noted.
Yeah, validating current practices, testing new treatments or devices, collecting data for national EMS improvement, always done under medical director and review board oversight.
The sources also remind us of those essential concepts we talked about earlier: safety first, using PPE, managing stress, and dealing with death and dying with honesty and support.
and the importance of health and nutrition for paramedics in this physically and mentally demanding job.
Makes sense. Regular exercise, eating well, staying hydrated, avoid the fast food trap, focus on a balanced diet.
Crucial for longevity in the career, also touches on the code of ethics, often mirroring the physician's code like the Arc of Geneva and that core principle, primum non nocere first, do no harm, be truthful and honest.
Finally, the concepts of duty to act and the standard of care are explained.
Right. Paramedics have a duty to act once they're dispatched or encounter an emergency on duty, and the standard of care means they're expected to practice with the same level of skill and care as a similarly trained paramedic in a similar situation.
Failure to meet that standard could be considered negligence under tort law if it causes harm. The plaintiff in a lawsuit would have to prove duty, breach of duty, harm, and proximate cause.
And the crucial role of medical direction. Every EMS system has a physician medical director who provides oversight, can be retrospective reviewing calls after the fact.
Or prospective providing guidance before or during a call. That includes offline direction through protocols and standing orders, and online direction via radio or phone communication during the call.
This whole area really underscores the significant professional responsibility that comes with being a paramedic. It's a licensed, regulated profession with serious accountability.
It really does. It's so much more than just responding to emergencies. It's operating within this complex legal and ethical framework that's designed to protect everyone involved. Now, another absolutely critical part of a paramedic's job involves understanding and administering medications. So let's get into some of the pharmacology basics.
Right. Can't do the job without understanding meds. Our sources define a drug simply as any substance that has a physiological effect on the body. They explain the different types of names a drug can have: its complex chemical name, its shorter generic name, its official name listed in references like the USP, and its brand or trade name given by the manufacturer.
Like ibuprofen is generic, Advil or Motrin are trade names.
Exactly. They also cover the various sources drugs come from: minerals, synthetically made compounds, living organisms like plants or microbes.
We also get a rundown of the many different forms that drugs can come in.
Yeah, extracts, powders, pills, capsules, tablets, suppositories, ointments, patches.
Liquids too, right? Solutions, suspensions, tinctures, elixirs.
Yep, even things like milks or emulsions, lotions, lots of ways to formulate a drug. And then there are the different routes of administration, how the drug gets into the body.
Broadly, enteral or parenteral.
Right. Enteral means via the gastrointestinal tract, so by mouth, oral, or rectum. Parenteral means bypassing the GI tract, usually injection. 4V, intravenous, either bolus or infusion. IM, intramuscular, SQ or SC, subcutaneous, under the skin. IO, intraosseous, into the bone marrow.
Also inhalation, down an ET tube sometimes, intranasal spray, sublingual under the tongue, topical on the skin, even intracardiac in rare cases.
Drug interactions are a really important consideration. Our sources explain different types like synergism, where drugs work better together than expected.
Potentiation, where one drug boosts the effect of another.
Addition, where the effects just add up predictably. And antagonism, where one drug blocks or reduces the effect of another.
And that critical warning about making sure that drugs are compatible before giving them through the same IV line.
Absolutely. Can cause precipitation or inactivation. Special considerations for giving medications to children, pediatrics, and the elderly, geriatrics, are also noted. Kids often need weight-based dosing and have different contraindications. Elderly patients might have multiple health conditions or slower metabolism affecting how they handle drugs, often needing lower doses.
And then we get into the essential area of drug math, calculations.
Can't avoid it. The sources provide basic examples of how to convert between different units of weight, like grams and milligrams. They walk through how to calculate the correct dose for a bolus injection.
Based on the patient's weight in kilograms, determining the milligrams needed per protocol, checking the drug concentration on the vial, and then calculating the volume in milliliters to draw up.
Exactly. They also explain how to calculate the rate for continuous infusions of medication, determine the dose needed, often in micrograms per kilogram per minute, mcg accretion, convert that to milligrams per minute, figure out the concentration or yield by mixing the drug and saline, know your IV drip set, drops, or DUQT per ml, then calculate the drip rate in drops per minute.
Deduce complex.
Takes practice and careful checking. Finally, they give an example of calculating fluid resuscitation for burns using the Parkland formula, like we mentioned, emphasizing working in the same units and the need for thorough familiarity with every aspect of a drug dose, route, side effects, contraindications before you give it. Double-check everything.
These examples really highlight just how precise and detail-oriented paramedics need to be when administering medications. It's not just about knowing which drug to give.
No, it's the exact right dose, the right route, the right patient, the right time, the right documentation, the rights of medication administration, and knowing how to calculate it safely and effectively.
Absolutely. Now, the final area that our sources touch on is the challenging field of behavioral emergencies. These situations often require a very different approach, focusing on communication, understanding what might be going on, and de-escalation techniques.
Yeah, these can be really tough calls. Our sources define a behavioral emergency as a situation where a patient is exhibiting symptoms, abnormal behavior, thoughts, or mood that suggests they might harm themselves or others, or they're unable to care for themselves.
And it's important to figure out the cause, right? Organic versus non-organic.
That's key. Try to determine if there's an underlying medical or physiological cause for this behavior that's an organic cause, like low blood sugar, hypoxia, head injury, substance intoxication, or withdrawal, versus a purely psychiatric cause, which is non-organic. The sources emphasize checking the patient's medications. Did they take too much, too little, or have a bad reaction? Always rule out and treat any immediate medical problems first.
General treatment often involves trying to calmly talk to the patient, verbal de-escalation.
Building rapport, active listening, trying to calm things down. But in some cases, it may also be necessary to use sedation or physical restraints to ensure the safety of the patient and the crew. Always the least restrictive means necessary.
The sources address suicidal ideation, which is having thoughts of suicide.
A serious concern. They highlight risk factors like past attempts, substance abuse, recent major life stressor, having a terminal illness. Assessment is similar to any medical patient, but need a calm, non-judgmental approach as the person may be agitated or even violent. Need to ask directly about plans and document carefully.
Delusions are mentioned, false beliefs that the patient truly holds despite evidence to the contrary.
Right, they truly believe it. Could be delusions of grandeur, thinking they're famous or powerful. Erotomanic, someone is in love with them. Jealous, somatic about their body. Or persecutory, someone is out to get them. The advice is to remain calm, don't argue with the delusion, just offer help and ensure safety.
Anxiety, with its physical symptoms like rapid breathing, racing heart, sweating,
Can lead to low CO2 levels from hyperventilating. Need to remember that high blood sugar can sometimes present similarly, so always check glucose. Phobias are extreme reactions. Panic attacks are common, intense fear. Key is to talk down, reassure, and rule out underlying medical causes.
schizophrenia, a long-term brain disorder affecting thought, behavior, emotions.
It's poorly understood, managed with medications, often multiple ones. Patients might stop taking them, leading to decompensation. Requires a careful, patient approach. Rule out other medical conditions mimicking symptoms.
And finally, psychosis, which is described as a complete loss of touch with reality.
Yeah, a more profound break. Symptoms often include delusions under hallucinations, seeing or hearing things that aren't there, disorganized or garbled speech, inappropriate actions or emotions. Treatment involves calm, understanding speech, being alert for potential violence, and considering benzodiazepines or other sedation if necessary for safety. This overview of behavioral emergencies really highlights the critical need for paramedics to have not only medical skills, but also strong communication and de-escalation abilities.
And a good dose of empathy and patience.
Definitely. To effectively manage these complex and often unpredictable situations.
So, as we bring this deep dive to a close, it's truly amazing to see just how multifaceted the role of a paramedic is. It extends so far beyond those initial moments of emergency response.
What's truly remarkable is the intricate way they have to weave together all this knowledge, from ensuring their own safety in incredibly diverse and challenging environments, to understanding the smallest details of how the human body works and how medications affect it.
Right.
All while navigating a complex world of laws and ethical considerations and providing crucial emotional support to people in crisis. It's a really unique combination of physical skill, intellectual knowledge, and emotional intelligence.
It really shines a light on the surprising depth and complexity involved in what might seem like a purely reactive profession.
Yeah, definitely not just scoop and run.
No. It's this constant need to make rapid decisions in incredibly high-pressure situations while also having a nuanced understanding of the human experience that's so compelling.
And if we connect this back to you, the learner, you've now efficiently absorbed a significant amount of information, hopefully, And you should have a really solid foundational understanding of the key aspects that underpin this absolutely critical profession.
And it really makes you think, doesn't it? Considering this vast amount of knowledge and the incredibly high-stakes situations they face every day.
Yeah.
Maybe something to ponder is, what are some of the most difficult ethical decisions paramedics have to make in the field? When protocols and patient wishes or family wishes might conflict, or when resources are limited. It's definitely something to consider, as you now have a much deeper appreciation for the dedication and expertise of these frontline responders.
Food for thought.
Thank you for joining us for this deep dive.